Hamstring stretching is something that we're encouraged to do when we've got lower back pain. It's something that we're encouraged to do, period. But how can you do it effectively, and how can you avoid the standard mistake that more or less everybody makes when they do this stretch? It results in, yeah, sure, a feeling of stretch and a feeling of relief while you're doing it, but it's actually making the problem worse if you are making this one critical error. In this video, we're going to talk exactly about that error. We're going to demonstrate on the spine so you can see exactly what it is. We're also going to go through 5 specific hamstring stretches that you can do, modified slightly with this error avoidance in mind, so you can effectively stretch the hamstrings, get the benefit of that without making your back pain worse. And ultimately, in combination with other bits and pieces, this is really going to help you resolve your back pain effectively without making it worse. Remember, before we get into it, do give us a thumbs up if you find this video helpful, and consider subscribing to the channel for more videos just like this. Now let's go straight into the first part of this video. So the number one error that everybody makes when they do this is just that folding down. Now, if you've been to a yoga class or Pilates class, or you've seen something online, you'll see this all over the place. Just fold down forwards until you start to get that stretch. And this is opening out the back, all these other bits and pieces, and we'll demonstrate that on the spine in a moment. But first, let's see what specifically we're actually talking about. Now, trust me to do a hamstring stretching video the day after training my legs pretty hard. My hamstrings are tight as it is. You could probably see that in that particular video. They're sore. So these stretches are going to be a little bit uncomfortable for me anyway, but they're obviously going to be effective. My range of motion is going to be quite limited, so maybe that's even a fortuitous chain of events that means that me doing these stretches is maybe going to be a bit more reflective of you doing them yourself. So you've seen a bad example or a classic example, that sort of fold down forwards, and that is the mistake that people make. And when we go through each one of these additional stretches, these 5 stretch variations for the hamstrings, I'll point out what classic mistakes people do make and why they're problematic. But let's cover it first on the spine. So why do we actually stretch our hamstrings in the first place? Well, the problem is when we have a lower back problem, we invariably get some degree of tension in our hamstrings. The way in which we live on a daily basis doesn't lend our lower body muscles, hamstrings, hip flexors, etc. It doesn't lend them with the ability to be strong and work properly. They tend to tighten up and get stiff. And when it's the case of the hamstrings, they plug into these little bony bits here. Those are the sitting bones. Most of us don't actually sit on the sitting bones. We slump back into the chair and sit somewhere on the coccyx or the sacrum. But that's another story. The hamstrings, when they're tight, they pull the back round into flexion, and that is a problem. You can see what that's doing to the discs. It's compressing those discs here. So if when we're doing our hamstring stretching, we're not maintaining a neutral lordosis and keeping the spine in situ and just doing that there, we're just folding down from the top, you can see we're actually getting the spine involved. And what invariably happens is we don't have any real awareness until things bite. So we're not stretching the hamstrings really at all. They might start to stretch, but we're not focused to them. We're just pulling the back all the way over until we reach some sort of stretching sensation. The problem with this is the hamstrings are controlled by these lower segments in the lumbar spinal. That's where the nerves come out. And if we have any sort of injury in that L4-5 and L5-S1, L4-5, L5-S1 region, then those regions are going to send signals to those hamstrings. So we might well do a lovely stretch and we go all the way down and we do it like I've just mentioned badly. We round our lower back and we get a stretch. But in the process, we're irritating these discs. We're damaging tissues that are trying to heal up on the back here. And fundamentally, we might well get a stretch in the moment, but we're making the problem worse. How many times, maybe you've experienced this yourself. You do something one day, maybe later in the day, a couple of hours later, or the next day, things get sore. And that's because this region of our lower back is not very reactive. It's not like you bang your funny bone and immediately you feel the pain. It tends to build up slowly. We do a bit of tissue damage, and then slowly that inflammation starts to creep into the area, and then we get symptoms a little bit later. It's very, very different. And that's why people get caught out into the false sense of security of doing these sorts of forward bending hamstring stretches and making their back pain worse without really knowing. You just go, I've been doing these stretches for the last week and I'm finding I need to do them more because I'm getting tighter, faster between stretches because we're doing it wrong. Now let's get into these 5 stretches. Remember, if you do find these helpful, give us a thumbs up and let us know in the comments, which one do you find most effective? Which one do you find most difficult? And which one do you find really is just the most comfortable and relaxing to get into? So the first one is going to be a sitting variation. You probably don't want to sit on a chair that's necessarily this low, but this is a nice one to have on the side just in case you can't. First thing we want to think about sitting nice and tall. We don't want to be rounding up. I'll show you what typically people do first and foremost. Get into that position and reach down and touch the toe. We've got a slight bend in the knee. Always have a slight bend in the knee, because if we have the leg locked out, we're going to stress the back of the capsule. The amount of times people do this inadvertently and end up with pain behind the knee is shocking. Don't have the leg locked out. We're not trying to stretch the capsule of our knee, we're trying to stretch the belly of the hamstring muscle. So you need a little bit of a bend in the knee so you feel it in here, the meat of the muscle, not the back of the knee. Very, very important. Now the classic one is this, but look what's happening to my back. I'm just stretching my back here. I'm not really stretching my hamstring at all. Yes, at the very end I can feel it. But if I do it properly, I sit up nice and tall and I stick my bum back, I've already got the stretch, a really strong stretch in the hamstring, and I'm nowhere near my foot because my spine has stayed steady. I've kept my spine like this, and all I've done is stick the bum out, and you see that takes this bone away from the knee without rounding my back. The rounding the back in this position, classic mistake, but it's terrible to do. Don't make that mistake. Number 2 is going to be standing up. Again, you'll have seen it all over the place, 1 foot forwards and rounding the back in order to touch the toe. Again, exactly the same errors. We don't want the knee locked out, we want it slightly bent. What you can do with this one is actually use the wall for a little bit of support. So you have your hands there, we have our body weight is on the leg that's furthest from you, so the back leg, and then all we do is stick our bum back. We've got a nice neutral spine, bum goes back, and boom, we get into it here. You will not get the stretch if you round your back. Now I have no stretch, but if I go from this position here, you can see my back, and I stick my bum out, immediately it kicks straight in. Some of you who are more flexible and don't have soreness in your hamstring from training yesterday will be able to go further before you hit the stretch. And you might want to play around with the foot position, rolling the knee in and out to make it more effective, or hit a different part of the hamstring. That's number 2 out of the way. This is a great one. I personally prefer this to the previous 2, and that is using a chair. It could be a higher chair, a lower chair, it could be a stool, but make sure the chair is in a sturdy position. We don't want to pop our leg on and it's going sliding off all over the shop. And again, very simple. Leg goes up. You might want to do a core engagement before you do that. If we're nice and wobbly here and we pop the leg up, everything shakes. Not so good if you're in a bit more back, if you've got a bit more back pain. So nice and stable, leg comes up. Again, slight bend in the knee. We can adjust our pelvic position to and from to slightly move around the back of the hamstrings. Got a slight bend in the knee, and then again, as soon as I go from this position and I stick my bum back, I've already got a hamstring stretch. Now, I already have a hamstring stretch here. I cannot touch my toe. With my back, I can go all the way down and touch my toe. That's not really intensifying this. All it's doing is compressing my back. I don't have a back problem. But if you've got a lower back injury, L4-5, L5-S1 disc injury, you've got some sort of strain to that segment, some facet irritation, some ligament damage, and you start doing this repetitively, sure, it's going to potentially feel nice at the time for the same reason those knee hugs can do, but you should not do that and you should not do them. And if you need any help on that, definitely check out the website. So for number 4, we're going to be against the wall. This could be a doorway with my leg through the door. This could be a wardrobe in the house, but we get into this position. One leg is going down. The reason that leg is going down is because it's going to protect our spine from tucking under, like we've discussed in previous videos. This is actually a really good one for later on. If you're not quite in as much pain, you're doing well with your rehab, this is a really nice one. Earlier on, it can be a bit difficult to get into this position, so if you're in very acute lower back pain, probably not the one for you. But we'll go through a little bonus with the towel as well on this one too. So first and foremost, get the leg up, slight bend in the knee. Again, I'm pretty much feeling the stretch already, but not too much. And we're going to just walk our leg up the wall, and then using our shoulders and our pelvis, scoot in towards the wall so our bum gets pretty close. And now I've got a nice stretch. If I go any further, my left leg is going to start to come up, meaning it's translating into my lower back, and that's not what we want. And we can just relax here. This is really, really nice. A little bit of pressure just down on the knee will just straighten it out a little bit, not to locking out like we've mentioned in previous techniques, but just straightening a little bit will intensify the stretch on the back of the thigh. Now for a bonus, what we can do is take a little rolled up towel. That's really going to fix the lordosis in the lower back. So we pop it in like so and allow our pelvis to drop in this position, and now I can't go as high up the wall. So for those of you that have a little bit more flexibility in the hamstrings, using that towel to fixate the lordosis in the lumbar spine is going to mean you can stretch the hamstring a little bit more effectively without having to go as far or as close to the wall. We can then scoot in again with the towel in situ and really get that strong hamstring stretch. Don't be alarmed on this one if you're down here for a little while. If you feet go a bit numb, that's completely normal. When we've finished, it's handy to be on a slidey floor like this because we can just bend this knee, slightly scoot away, let this leg come down slowly and move off to the side and then slowly roll over. But dismount from this stretch carefully, please. So this is the last variation, and to be completely honest with you, if you've got back pain and you're recovering, this is not going to come in until a little bit later on, used in any meaningful way. That being said, if you really do struggle to feel the stretch because you can't move your back properly, this can be a really good option. Now, really bear in mind as well, the instability that many of you guys will have down at that lower back level, down here at the L4-5, meaning that it's so very easy for you to do these stretches incorrectly. It's so very, because there's damage down here, this stuff wobbles all over the shop, and it's your job to learn to engage the core to stabilize this from happening in the lumbar spine, because it will do willy-nilly, especially if we've had a long-standing back problem or we've got recurrent injuries in this region that haven't resolved. There's going to be instability down here, so it's all too easy for this to happen during these particular exercises. This is where the band can be helpful, and later on it can be helpful as well. But just really bear that in mind on all of these stretches. The instability in your lower back, if you're not able to do these stretches correctly, it's because there's that inherent, ingrained movement pattern, erroneous movement pattern, that has been there for a long period of time. And you need to learn to do that, because that movement pattern, that bad movement pattern, is probably, or will be, at least contributing to the reasons that you've got the lower back pain in the first place, and certainly contributing to the reasons that the lower back isn't resolving. Because every single time you do anything with the body, that area is just going to move of its own accord. And that's why doing these stretches in conjunction with other work, strengthening work, is so very vital. You can't just get away with stretching till kingdom come. It's not going to work for dealing with back pain long term. It has to be part and parcel of a more robust approach. Now let's get into this particular example. So the band, this is a great one. You've got to take a strong band. Have it around about the level of the door. You can see it's anchored in with a door anchor here just above the handle of the door, because we want a slight up, we want it slightly higher than my pelvis. And what we do is we clip this in here, and this is just underneath the bony bits. It'd probably be helpful if I got the spine to show you. So if this is you, we find these bony bits on the front of our pelvis. I've got very long legs and a short body. You might too. It's quite high on me, all the way up here. That's these bits here. This, the hook, needs to go underneath those, because what that does is pulls us back into a degree of anterior rotation and lordosis. It fixates that and stops us from tucking our bum under when we're doing this stretch. So if I get in and show you what I'm talking about. So if you're using one of these clips, make sure you move it out of the way because it's just unpleasant. Now it's underneath these bits, and this is very similar to the standing stretch that we did earlier. We want to move away from the door so we have a bit of pull. It's pulling me backwards into that position. Core's engaged, spine is nice and neutral, exactly the same position as earlier, but let your bum be pulled back by the band. If you need a bit more force, you can double up bands or use a stronger band, or just walk a little bit further away. Make sure it's obviously locked properly in the doorway. You'll notice this door closes this way, very, very important. Make sure the door's closed, otherwise you get a nasty surprise if you pull too far away or someone else opens the door. But we just let our bum slide back, and it's so easy to do with the band. We keep everything nice and strong, and boom, straight into a hamstring stretch. All the way, my spine stayed nice and neutral. This just helps you get that movement to start with. And with time and practice, you'll be able to do this movement without using the band. It's just an aid to technique. And just for reference, my foot was out of shot, but this is what it's doing. It doesn't matter whether it's up or down, that's just personal preference. Whatever you need to do to get that stretch with this foot here. You can do a little bit of dorsiflexion or keep the foot completely flat. You'll feel it pulls a bit more in the calf, one versus the other, and that's really up to you, but there's no right way or wrong way. Sometimes people get caught up in what's happening in that foot, and it's really a lot less relevant. So that's it for the hamstring stretches. Let us know in the comments, which one did you find easiest? Which one did you find hardest? Which one surprised you the most? And which one helped you feel it? Some of them may not be as easy to do logistically, practice-wise, but once you get good at them, you'll find that some of them will really, really help you hit that hamstring nicely in a way that allows you to keep the spine neutral and protected and really do the important stuff. But remember, this is just part and parcel of an effective rehabilitation program, and you cannot do this and expect it to work without appropriate strengthening work alongside it. Please do not forget that, otherwise you're really going to get stuck in a little circle. There'll be a card up here to learn a little bit more, and with that, I hope you found this video really helpful. I hope you've learned something. Consider sharing it if you did find it helpful. Consider giving us a thumbs up, comment below, and remember, you can always subscribe to the channel to stay up to date and know every time we release a video just like this. Thanks for watching.